Hello guys, and I am back with another episode of the FTM's Guide, and today we are talking about risk, the real risk, the real nitty-gritty of surgery. It is not always rainbows and sunshines like you see in the videos that all these trans guys put out on YouTube, that it's the best experience of your life. There are real risks to any and every surgery. It doesn't even have to just be FTM surgery, but just in general, we have real risk to any surgery. Now, first of all, not just the risk, but also the healing time, the ugly part of surgery. So first of all, what you guys might not realize is with any surgery, there is the recovery period. And the recovery period is not as fun as everyone thinks it is. I mean, with top surgery, you're having a recovery period of 3 months. With bottom surgery, recovery period of 3 to 6 months as well. And the thing with, I'll start off with top surgery. So first of all, top surgery, the recovery period, the pain level, for me personally, having this top surgery wasn't that painful. You just felt really tight and it had a stinging sensation. The actual part of the scars didn't hurt that much, but what actually did hurt was this part. It was my lat muscle was very tingly. It's very tight. You can't really move up. It stings and kind of aches. The same with this part. Now, the tingling sensation in my in the side of my back, my lats, didn't actually go away until the first year of surgery. And you know, it's still swelling, it's still kind of like your muscles are still developing. It does take a while for it to heal. Now, in terms of the healing, it should take anywhere between 2 weeks to a month to actually start having it noticeably, the pain go away. You should start not feeling tight until the first 3 months. You shouldn't actually exercise until 3 months to 6 months have passed in order not to have these scars, and that's what I didn't listen to. Now, the ugly part is, you know, you're gonna have drains, it's gonna hurt, it has to drain the extra blood out. Pulling the drains out is not fun. Being limited with movement is not fun. I had that in my previous video, you can check it out, so I won't cover it too much in terms of top surgery. Now, bottom surgery. First of all, it is the most painful surgery I've ever had in my life. It is very painful. You don't realize how painful it is, but it's an indescribable pain. As soon as I got out of the surgery room, I could feel everything. I immediately shot up, awoke because I was in so much pain. And the thing is, you can't push, you can't have to do number 2. It hurts, everything feels tight, and you know, just the healing process in general. Like I said, the healing process isn't linear. Same with top surgery, same with bottom surgery. It's not rainbows and sunshine. It's not beautiful and you wake up and everything is healed and it's done. Besides the recovery time, there are complications. You can get, you know, it can get swelled up, it can get infected like this. These can get infected, and the infection just leads to even more dangerous infections, and you get a fever, you can get sick, you can even possibly die. These are some things just to consider with surgery. In terms of my bottom surgery, it didn't go smooth sailing like I thought it would. It was constantly swollen. It didn't stop swelling until the first month, the first few weeks of surgery. Some days it would swell more than the others, some days it wouldn't swell. Even, you know, with my doctors taking care of me for 2 weeks, they even commented that like the swelling is going down slower than they thought it would be. You know, the constant swelling and the numbness in that area, you actually kind of think, is it ever gonna get better? Is the numbing ever gonna stop? There are a lot of scary things, and because, like I said, with bottom surgery, everything or this is just taped up. If it's swollen, you know, your scars can open again, things can get ugly, things can open. And with me, like I said, I keep saying like I said, but if you see in my previous metotioplasty video, you can also see that I got an allergic reaction to medication, which made my bulge swell up even more, and that scared the living crap out of me. I didn't, you know, it was, for me, it was the most frustrating thing, never knowing that if it's gonna get better, never knowing if you're gonna heal 100% or not, never knowing if it was worth it. You know, I did have some thought of thinking if having bottom surgery or having surgery at all was even worth the extensive healing time that and how exhausting that could be. Now with phalloplasty, that's incredibly a risky procedure. You know, you really need to make things clean down there. There's a lot of hygiene and things that can happen to really make it infected. Now the main thing with surgery is rejection and infection. Rejection is that your bottom rejects the new tissue, so it ends up with, you just end up with dead tissue and you just end up having to take it out. okay? It's scary, it's a real risk, it's something you have to consider. And with infection, obviously, with infection, it's gonna take a longer time to heal, it's gonna be swollen, blood's gonna be gushing, it's gonna have pus, and people really go through that. Like I said, you only see the glorified part of it, but you don't see the real reality of surgery. The risk and complications that can happen, and with any and every surgery, like I've said it a million times, the recovery period isn't fun. It's tiring, it's exhausting, it's draining, it hurts, it's uncomfortable. It takes a while for you to live a normal life again. In terms of my surgery with bottom surgery, and I'm sure with phalloplasty and metoidoplasty, you need to keep your catheter in for 2 weeks, 3 weeks even sometimes. And I have to carry a pee bag with me everywhere just to go walk. Doctors do strictly advise that you try not to go out, but I wanted to go anywhere because I didn't want to stay in my room. And it was, it's awkward trying to like find ways to hide it. I mean, I hid it pretty well, but it is uncomfortable having to have my catheter, it broke 3 times. It got loose 3 times. I don't know what hit it. I don't know what caught it, what snagged it, but then it got loose and I had to put duct tape and I had to make trips. I had to make 2 trips to the hospital. It was 2 days before I got my catheter out, one of the times, and the other time was like 2 weeks before I got my catheter, and one time was another week before I got my catheter out. And it's frustrating having to go back to hospital to change the catheter, then come back and then wait for 2 days and then you get it out. And that was just, it was a horrendous experience. Like, yes, is it worth it once you've healed? Yeah, it is, okay? It's totally worth it when you're finally feeling great, you're finally happy with your body, you finally feel the way you were meant to be. But just take into consideration that it is a lot of hard work, it is tiring, it is draining, it is extensive, and it is painful, and there are really, really dangerous risks and complications that can really go with your surgery. So really do your research, please make sure you're safe, please make sure you're being clean, take your doctor's advice, and good luck with your surgery. So if you like this video, please give it a thumbs up, please subscribe if you're new for more content like this, and I will see you in the next one.